right?
Mm-hmm.
So what should be coming here?
The sensory.
Sensory.
And motor.
That's what?
Motor.
That's what? The one coming from the lateral.
Lateral.
Autonomic.
Oh, that's
Right? So this is motor, what's coming out eventually of both of them, but that's somatic and that's autonomic, right? Remember when we said that? In the lecture?
Somatic.
Somatic coming from the ventral, autonomic coming from the lateral.
Okay.
This is what? This bulging thing.
The ganglia.
The
Ganglia.
right? So this
It's
might
a bundle
be,
of
yeah,
Cell bodies.
cell bodies. So this might be the best model if I want you guys to label the ganglia, right?
Okay.
And then you say dorsal root.
Dorsal root of the
ganglia.
ganglia.
dorsal root ganglia.
And this is wrong because
This
it
one,
extends
I
the
thought-
whole thing. It's not supposed to extend.
And this is another model where I can label the lateral horn, right?
Right.
It's showing well. I might not see that in the slides, but I can see it here.
That's
right?
the
So
lateral
this is
horn.
lateral horn.
What?
Lateral horn, dorsal, ventral.
Wait, I
Yeah.
thought this one was ventral.
No, the dorsal is the one that is pointy and
Close to the
close
surface.
to the surface. The ventral is more rounded and away from the surface.
And this
Okay.
is the lateral.
So the
You're right.
the
Towards the
ventral,
lateral side is the lateral.
and so the ventral has the motor
Right.
ones.
SS, so the dorsal is the
Sensory.
sensory.
That's right.
The ventral is the motor. The
Okay.
lateral is the autonomic.
Okay. Okay.
Such a bad
And then this.
Such a bad student.
All right. So then this,
A reflex arc.
the reflex arc. Let me move this trash can.
Okay.
What's the question you would ask after the reflex arc?
What questions? So first of all, what does this represent? Reflex arc. What type of neuron is this? Functional. If I say the
Oh.
functional
It's
type.
sensory.
Sensory.
Okay.
What is this?
Motor,
What is this?
cell body.
No, the whole
It's
neuron.
neuron.
What type of neuron is that? Interneuron,
Okay.
right? It's the communication between both of them. What
reticular.
component, or I might ask, what component of their flex arc is this? Effector. So remember
would ask
the
what-
components.
The components
It was
of
a
what?
receptor, sensory, integration center, and then motor, and then effector, right?
Gonna study that. So wait, you said you'd ask us what that and this.
Okay, so forget about this one. So what type of neurons? Dorsal, ventral, right?
Yes.
Doesn't show the lateral,
Lateral.
well. And
And
what does that represent? It's a reflex arc.
and
These are receptors.
okay.
So basically the receptor, effector, and that reflex arc. I think the type of neuron might be nice. This is unipolar
Right.
neuron. This is what? The whole bulging part.
The ganglia.
The ganglia.
Dorsal root. Is it dorsal root?
Dorsal root ganglia. But
Okay.
again, the best, I think, in my opinion, the best
that
Yeah,
one.
that one, because you can
view
see that
is
long
this.
good.
This is the dorsal
Okay.
root ganglia.
Okay.
Okay? So pretty much that's
This
it.
model the only one that showed the lateral too, though.
This is the only one that shows the lateral.
So that
Okay.
might be a
This is wrong
That's
because it
fine.
needs to stop at L1.
Right, because the anatomy of the spinal cord should stop at L1 or L2. Here
Right.
it extends all.
Right.
Is the green the duct or the gland? The green is the.
Those are
The
the
green are
ducts.
the ducts. The gland is it looks like a gland, right? It's has some
So sac,
sac
Gland.
gland
Ducts.
ducts.
Okay.
sac gland.
And that's the lacrimal. The lacrimal.
Right.
Okay.
With where tears
Wait, what's the
come
lacrimal?
from?
So this is the lacrimal sac, lacrimal duct.
Okay, both of these.
No, lacrimal gland, lacrimal duct.
Okay. And then
The chlor. Let's see.
caruncle.
Caruncle.
Caruncle? That's the
Both
Where the
inside.
tears
Same model, right?
Where
That's-
they will flow from. That's the pink.
The pink. The tears flow from the caruncle. Oh.
Lacrimal.
Okay.
Lacrimal. Wait, what did I say? The green is the
The
ducts.
ducts.
Okay. How do you remember everything? Like, this is just crazy.
You
Okay.
do or you
And then
don't?
you have
How do you remember everything? Like,
medial.
I feel like my brain would explode or something.
Wait, no. Yeah, medial,
I was like this when I
Muscle.
was a student.
For real?
It's crazy.
lateral muscle.
Okay, you said this model
Things
wrong because it
change.
extends past the L1 and L2 vertebrae.
Right.
And then Inferior.
Inferior,
Inferior.
down, superior,
Superior.
medial, and lateral.
Right.
And you know the medial side from the nose, right?
Right.
The medial is towards the midline, and the nose is at the midline.
And then this one's by the ear.
What would this model be named again?
Nothing. So there's no name.
No name
This
for
is a
that.
reflex arc. This is just showing where the
The part.
the parts.
This is what it looks like in your
spinal
eye.
pathway.
That's so crazy.
Yeah.
Okay, then we already did this one. Here. What's this?
Oh, girl, I got you. Okay. So we have the cornea.
Cochlea.
Cochlea.
Cornea is the eye. Come on.
You got me, right? You got this.
Okay.
You got this.
Okay, I just had a little mess up. Okay.
This is the ear, right?
Right.
Okay.
Okay, go
we
ahead,
have
girl.
The cochlea. Then we have the cochleal branch, and then we have the vestibular branch, and these together make optic nerve aids.
No.
And
Cranial nerve.
cranial nerve.
Cranial nerve
Cranial
aid,
nerve
which
aid.
is called to put the both part together.
Vestibulocochlear.
Vestibular and cochlear makes vestibulocochlear.
Vestibular
Cochlear
cochlear
nerve.
branch, and then we have the don't tell me, we have the vestibular canals.
Canals. Right.
Yes.
It takes me a minute, y'all. It takes me a minute. Like
So
You
maybe
did good.
it's called cochlea, right? So it
Cochlea.
ends in EA. So it's
Ear.
vestibular.
Ear.
wow.
Easy.
I'll remember
She's so
that now.
smart.
Yeah, I'm gonna do
She's
that now.
awesome.
The cornea is the eye.
Okay. Lacrimal. So we're still gonna have like a minute to like 2 questions.
A minute 15 seconds, and for you guys, it's remember I give you a minute 30 seconds because I don't give you time at the end. So it's a minute 30.
Would we need a... Is this one that could be on there?
No.
I'm not sure how to look at it.
I can if I want you to see that this is the
Where
iris.
do you live in?
I
Okay.
think this is the best
This is
one
good.
showing the iris.
Okay.
Or the
That's what it
sclera.
is.
I mean, that's clear.
The
right?
sclera.
Lacrimal canarcle.
Iris.
This is the sclera?
It just says
The
lacrimal.
white thing.
The white
So
on the
sclera
outside?
is the white, yeah, the
Okay.
white thing that you
And I know.
see on the outside. This
Okay.
is the lens.
Right. Oh, and that's the jelly-like stuff.
Exactly. That's the vitreous humor.
Right.
So yeah, it's light. It's actually it's easier than this for showing the external part.
Right.
So unless it gets broken. So yeah, it's easier showing the external part than this one, which folds.
Oh,
Okay.
so those on this model are those right
But
there.
then this one will be the
Different
best
eye.
one to show the lacrimal, sac, gland, and ducts, right?
Right. And the cornical.
Where's the rectus and stuff? Is that on this one?
Is this the
Yes.
lateral retina?
Yes. So this is the
The
nose. So
side.
this is the medial, right? This is the midline of your body.
Mm-hmm.
So what's close to here is the medial. What's close to here is
Yeah, I
the
guess that based off of common sense.
Superior,
Okay,
inferior.
so
Yep.
so it wouldn't be on this one. It'd be on this one. And so this is
lateral.
gonna be
With the muscles.
the
Yeah.
lateral rectus, and this is the medial rectus.
Mm-hmm. Which is, I guess, is the same thing with these. Would be those.
Yeah, but the thing is,
You have to know where the nose is.
you can kind of know because this is the
This is
zygomatic
superior,
bone,
right?
right?
Oh, so this
So
is
this
the
is
nose.
medial.
Oh,
No. That's
Zygomatic,
no,
right
this
here.
is zygomatic
Right here. It is.
But I
Off to the
don't think
side.
that's not clear enough. I think that's clear.
So medial
Mhm.
rectus and then lateral rectus.
And
Right.
superior and inferior.
Right.
Okay, let me get the check.
So, and then we just need to know the function.
Okay, y'all.
Which
Inferior
corresponds
kinda,
with the name.
yeah, the name kind of gives
So it
it.
makes it move up,
Superiorly,
makes it move down.
superiorly.
Okay.
Side and side.
And you guys don't have the oblique. We'll have the
Okay.
oblique.
On these models over here, we gotta know that's all of them that's on this check.
Oh, the brain, yes.
Yeah,
But the brain we mentioned last time, the neuron.
I remember you said something about a question can come from this, and what about this?
Yeah, what does that represent?
And there's, you said
Is that a mitochondria?
Mm-hmm.
a
What do you think?
neuromuscular junction?
Yeah. The junction?
A neuromuscular junction.
Neuromuscular junction or synaptic cleft.
Cleft.
Mhm. And
Synaptic
what other question can
vesicles.
come from now?
What do they have inside? What?
Those are the
Chemical.
vesicles?
What do they have inside?
What do they have?
Action potential?
Mm-mm. What
No,
the
that's the outside.
neurotransmitter is?
We talked about that.
Acetylcholine, right?
Ah, that's right, because it transfers.
Mm-hmm.
That's right.
And then the neuron. We've got the cell body, dendrites.
Oh, that'll be pretty easy.
Axon.
Oh, you just asked what the part is?
Do you know what part is this?
It's a muscle.
Mm-mm.
No?
It's the axon hillock.
That's what
The
connects
axon, what
the
it is?
actual axon, right?
And then that's the axon, what this is, that white thing.
Wait,
I
you
wanna
said
say myelin sheath.
Yes, go ahead, myelin sheath. So what
nice.
cell is this? What nucleus is it for? Schwann
Atta
cell.
girl.
And then what this gray layer is?
Axon.
That's the
No.
axon. That's a layer of connective tissue surrounding the axon. Remember epineurium, endoneurium, and
Oh,
perineurium?
yeah.
So this is the endoneurium. This is the only actually field that I can label an endoneurium because it doesn't show well on the slides. So this is endoneurium.
Okay.
Similar. This one's similar.
Okay, that one's just like the
Okay,
same
but
as
it ain't
this.
as complicated as
this-
it looked.
These are this.
Cause
and
their
this
model
are
look
the same.
complicated. It
Oh,
look like
no,
a
it's still
chiller.
the same.
It look.
It's just
Looks like it's hooked
Too
up
much
to a
numbers.
battery.
It don't look.
yeah.
It like
But
a
then
kid
this
make
is a
that model.
skeletal muscle, right? So this is a neuromuscular junction as well, right?
So is that like that one over there? No, no,
Which
it's not.
one?
Never mind.
No, no.
it's
This
not.
is a reflex.
Right.
This is because it shows the spinal cord. This is just showing, like this part to the end of this part,
Right.
like where the muscle is, but
Yeah.
not the whole thing. And then yes, you have to look at the brains. This one, and this one. Don't look at this one. This
This
is not
one,
good.
that one, and that one.
Yeah.
Got
Okay,
it.
like what's the question you ask on the model brain that you want to ask on
Anything.
the regular brain?
No, anything can be
'Cause
asked
they-
here or there.
Yeah, they kind of. I like that model better though.
I mean, I mean, there's nothing that I think I can ask here and not totally ask. Anything can be asked here or there. This is the lateral ventricle, right? Shows nicely. But on the other side, this is the septum pellucidum, which is actually separating the ventricle on the right side from the ventricle on the left side.
So that little deep gap is called the what now?
They don't mean really a gap. They are having it not this shape, not that ventricle, because they want to show that this is a membrane that is separating another ventricle on the other side. This is something that might not show on the real
Yeah.
Okay.
one.
I need to study the brain the most.
But I can't think of anything that we cannot ask on the actual brain.
Okay.
This is simpler than what it looked like. From a like when I just looked at it, I was like, oh,
I think that's it, right?
yeah.
Do we need to know anything about the knee joint and the reflex thing? No? Okay.
So the brain, the neural junctions, and the eye,
And the spine.
Right.
and the reflex.
And the muscle.
And the reflex.
Muscle.
Yeah, I forgot
Which
about the muscle model.
The muscle
Oh,
models.
yeah. Of course, this comes with the rabbit. Like you have to know, and I'll make sure that I posted the origin and insertions. I think I did.
You
I'll
did.
Make sure. I did.
Yeah.
Okay.
Yeah. Mine
So
won't
the
load
origin
up
and
though.
insertion.
Really?
When I click on it, it say page not found.
Really? Okay, I'll make sure that it opens.
So,
What key things do we?
Here,
she
I'll send you
had
the video.
said, what those are?
seminal
What is this
vesicles.
model?
What does it represent?
The synaptic
Cleft.
Cleft or neuromuscular? I mean, you won't say neuromuscular. If you say neuromuscular, that will be correct. But since there's no muscles, if you say synaptic cleft, that will be correct too. What are these vesicles?
Are
What do they
these
have?
acetylcholine?
That's a mitochondria, but I won't
Mitochondria.
label this.
Okay,
And then this is axon. What's this white thing?
that's the myelinated.
Myelin
sheath.
sheath. What is this? You said this is one cell. What is this? Connective tissue. What this layer is?
Endo.
Endoneurium.
Endoneurium.
What this part is?
That's the axon part.
Axon hillock.
Axon hillock.
The whole
Right.
thing
It-
is the
that
axon,
connects
but
it
this
to-
connection between the cell body and the axon is called axon hillock.
Okay.
Okay, these are dendrites. This is the same. They were asking what questions could I ask on the brain that I cannot ask on a brain
It's
model,
anything.
and basically anything because they show the same thing. But one thing that I can think of is this is the septum pellucidum versus this is the lateral ventricle, right? So
Which one's the septum?
like that doesn't show
Oh,
a
okay.
big gap
Mhm.
or something. So I might have both of them side by side and ask you to what is this? This is the lateral ventricle. What is this? This is the septum pellucidum.
Okay. Cool.
Sounds cool.
Yep. So would between for the rabbit muscles and our muscles, they could, like, you could ask
They go hand in
something
hand.
on a rabbit muscle, but like, and it's the same function as our body.
Right. So I can
Okay.
have the deltoid on the rabbit
Right.
labeled, and then ask you what function does it do, or what is the origin or insertion. Then you should mention the
Okay.
or I might make it clear and say what is the origin of this muscle in the human.
Yeah, I'm just
Right.
I'll
Make it clear.
But hell, we can come left Thursday too, though.
You can come Monday or Tuesday
Of next week.
of next week, and you can come Monday and Tuesday of the week after Thanksgiving. But if you come Tuesday, make sure you come before 2 o'clock, because at 2 we will close the lab.
Okay.